The bones of the skull connected by the three different ways: immovable type of joints as synarthrosis, slightly movable as hemiarthrosis, and movable diarthrosis. These three types connect bones of the skull. Synarthrosis examples as sutures, ligaments, gomphosis, and fontanelles, which present in the newborn. Synchondrosis between the base of skull bones. Synostosis, like example of fusion different parts of the bone in the one single bone. Hemiarthrosis present in development stage of the skull in newborn. And diarthrosis is a true joint, temporomandibular joint between the temporal and mandible. Synarthrosis. On the skull, present four types. This syndesmosis, like example of immovable type of joint, present between the all parts of the skull. First example of syndesmosis is suture. They classify in serrate suture, such as coronal suture between the frontal and parietal bones, as named after Roman Empire, which wore a crown. Second one is sagittal suture between the two parietal bones, exactly in sagittal plane, and lambdoidal suture between the two parietal bones and occipital bone, named after the Greek letter lambda from Greek alphabet. Next example of the suture is squamous suture, which located between the squamous part of the temporal bone and neighbor bones. And last example of sutures of the head is plain suture. And example zygomatico-maxillary suture. Mostly all of facial bones used together by plain sutures, which has name after the bones which form the suture, like between zygomatic and maxilla is zygomatico-maxillary suture. Next type of syndesmosis is ligaments, which is two present on the skull: styloid ligament between the styloid process of temporal bone and hyoid bone, and pterygospinous ligament, ligamentum pterygospinale, between the pterygoid process and spine of phenoidal bone. Next example of syndesmosis is gomphosis between the tooth and socket. On the model of tooth, the gomphosis is located between the root of the tooth and socket. It's present by these small ligaments which present inside the socket. To see better it, we have to hide other structures and isolate all periodontal ligaments in this region. And you can see in better view all these ligaments. They are between the cementum of the root and socket of the alveolar process of maxilla or mandible. Synarthrosis example as synchondrosis. Synchondrosis present on the skull in the two options. First, it is temporary and permanent. Temporary synchondrosis present between the sphenoidal bone and occipital. We call it spheno-occipital synchondrosis, which present on this side during life from the first stages from the childhood to maturation and adultness until 25 years and become one single bone. Second example of synchondrosis on the skull is permanent, which present here in the type as retrooccipital synchondrosis. Retrooccipital synchondrosis between the retrous part of the temporal bone and lateral parts and basilar part of occipital bone on the region of the jugular foramen, and sphenopetrosal on the region of lateral foramen between the sphenoidal bone and temporal bone, between the sphenoidal bone and temporal bone. Synostosis on the skull, located in different regions and parts of the skull and related with points of ossification and growing of bones, and their destination as fusion in one. For example, different parts of temporal bone, 2 halves of mandible, 4 parts of occipital bone, parts of maxilla, growing of the frontal bone, etc. Diarthrosis of the skull or synovial joint of the skull is temporomandibular joint, which is paired formed by the 5 main parts. First of all, it is head of the mandible, mandibular fossa, of the temporal bone, articular capsule, ligaments of this joint, and articular disc which is located inside of the joint. There is mandibular fossa of temporal bone, head of the mandible of mandible, articular capsule which is very tough and strong, and articular disc which separates synovial cavity on two compartments, superior and inferior. This joint has three ligaments. For example, lateral ligament which isolate and prevent hypermobility to side and backward. Stylomandibular which pull the mandible backward and prevent hypermobility forward. And sphenomandibular which prevent lateral dislocation of the mandible and help in the opening of mouth. Movements of the temporomandibular joint. The temporomandibular joint has three main movements. First movement is opening and closing of mouth in frontal axis. Second movement is retraction and protraction of the mandible, movement forward and backward. And last type of movement of this joint calls lateral movement of mandible in vertical axis in two joints together. As you can see, the two temporomandibular joints work together and can't work isolatedly. Consumption. The temporomandibular joint is simple because it's formed by fusion by the relationship of the temporal and mandible. Second, this joint is complex because inside of the articular cavity it has discs which separate it on the two compartments. Third, this joint is combined because it moves together in two joints in one time and can't move separately. By shape, this joint is bicondylar and biaxial, but presence of the disc increase volume of movements to the three types of movement. First, this movement is movement mandible, front and back. Second movement, moving of the mandible to the side. And last movement in the frontal axis, opening of the mouth and closing